The U.S. Centers for Disease Control and Prevention, CDC, has issued a new round of travel warnings after the mosquito-borne chikungunya virus spread to several regions across the world. News.com has learned that outbreaks have now been reported in parts of Africa, the Americas, Asia, Europe, the Caribbean and islands in the Indian and Pacific Oceans, prompting the CDC to place 8 destinations under an elevated advisory. The CDC recently updated its travel advisories to include Kenya, Madagascar, Mauritius, Mayotte, Reunion, Somalia, Sri Lanka and the Santa Cruz Department in Bolivia. Each destination has been placed under a Level 2 advisory. Practice enhanced precautions for this destination. The Travel Health Notice describes additional precautions or defines a specific population at risk, the CDC said when issuing the warnings. The designation means that travelers to these countries should take stronger preventive measures than usual, as local outbreaks continue to increase the likelihood of transmission. Chikungunya is a viral disease transmitted to humans through the bite of an infected mosquito, primarily the Aedes aegypti and Aedes albopictus species. Most people infected with chikungunya virus develop some symptoms. Symptoms of chikungunya usually begin 3 to 7 days after a bite by an infected mosquito. The most common symptoms are fever and joint pain, the CDC said in a statement. Other symptoms may include headache, muscle pain, joint swelling or rash. Most people get better within a week, however, some can have severe joint pain for months to years following acute illness. While fatalities are rare, the CDC notes that newborns, adults over 65, and individuals with underlying conditions such as diabetes or heart disease face a higher risk of severe complications. According to reports, there is currently no specific treatment for chikungunya. Care is focused on relieving symptoms, and 2 vaccines have been licensed in the United States to help prevent the disease. The CDC advises travelers to minimize their risk of infection by avoiding mosquito bites whenever possible. Recommended steps include applying insect repellent, wearing long-sleeve shirts and pants, and staying indoors in air-conditioned environments or places equipped with window and door screens. Because mosquito activity is highest during the daytime, officials stress consistent protection throughout waking hours. The CDC further advises pregnant individuals to avoid traveling to areas experiencing chikungunya outbreaks, citing risks to both the parent and the child.